Hello and welcome. My name is Nancy Berry. I'm the Marketing Manager for Rosewood Centers for Eating Disorders and your host for the Rosewood Institute webinar series, Mindfulness 101, an introduction to the science and practice of mindfulness meditation. Joining me in the studio today is Dr. Thomas Best. Dr. Best completed residency training in psychiatry at Banner Good Samaritan Hospital, where he was named Chief Resident and Resident Teacher of the Year by the University of Arizona College of Medicine class of 2004. He then accepted a position with the Carl T. Hayden VA Hospital and held teaching positions at Good Samaritan as adjunct faculty and Midwestern College of Medicine as Assistant Professor of Medicine. Dr. Best then moved to the Meadows, where he served simultaneously as Medical Director and Executive Director. Dr. Best co-founded Optimal U in Scottsdale, Arizona, a collaboration of mental health practitioners where he currently practices. Dr. Best consults with the Arizona Medical, Nursing, and Behavioral Health Licensing Boards, evaluating impaired professionals, and teaches mindfulness meditation to individuals and groups. His holistic approach supports clients to access their inner resources to facilitate emotional and spiritual growth. He integrates Western medicine, psychotherapy, and the ancient practice of mindfulness meditation. Dr. Best is EMDR trained and has studied mindfulness meditation extensively. Welcome, Dr. Best.
Thank you very much for that introduction, Nancy. Glad to be here today. Today I'm here to talk about mindfulness meditation. I'd like to present a introduction to the science and the practice of mindfulness meditation. First, I'd like to start by discussing the recent paradigm shift that we're experiencing in the fields of psychology, but also related life sciences field and even the applied sciences and the arts. And that's this shift toward a transition from studying and focus of the left brain language-based cognitive process to the embodied functions of right lateralized emotion processing limbic system and the stress-regulating HPA axis. There's a surge of neuropsychiatric investigations into the dysregulation of the limbic and the autonomic nervous systems in a wide array of axis 1 and axis 2 disorders. It's clear that psychotherapeutic changes in conscious cognitions alone, without changes in emotional processing, are limited. CBT is being challenged and updated by affectively focused psychodynamic models. There is now much more emphasis on context than content, and on affect rather than cognition. I'd now like to talk a bit about left hemispheric versus right hemispheric brain function. Our left hemisphere of our brain is more or less a computer that's specialized for the control of very well-established patterns of behavior. It's very detail-oriented, and this is the part of our brain where we process linear information. Verbal, conscious, and rational thought. Our left hemisphere is very detail-oriented and rather inclined to self-interest. In contrast, the right hemisphere is the primary seat of processing emotional arousal and novel information. Nonverbal, unconscious, integrative, and holistic subjective information processing occurs here. Empathy, compassion, morality, creativity, flexibility, and generosity are also functions of the right hemisphere. Researchers no longer think of the brain as two halves of a single entity, but rather two computers that function in parallel. The two hemispheres of the brain process information quite differently. This is also supported by numerous studies revealing that right and left hemispheres differ in macrostructure, physiology, chemistry, and the control of our behaviors. On the next slide, we see a cartoon that illustrates the organization of our left and right hemispheres. You'll note the left brain houses writing, language, and our more linear thinking functions such as mathematic and scientific skills, lists, and logic. So linear thinking in the left hemisphere versus the right hemisphere, where we think much more holistically. This is the seat of our emotional expression, spatial awareness, creativity, imagination, and a sense of getting the whole picture. In the next slide, I present a more experiential type of view of the left versus the right brain. If we look at this slide on the left, we see less color and numbers, facts, and data. If we look at the slide on the right side, representing the function of the right brain, we see much more depth of color, imaging, and wholeness. Alan Shore, the noted researcher, stated that an expanded capacity for right and not left brain thinking lies at the core of clinical expertise. Much of the therapist's knowledge that accumulates with clinical expertise is implicit, operates at rapid, unconscious levels beneath the levels of awareness, and is spontaneously expressed as clinical intuition. So I present this information as a backdrop to the discussion of mindfulness, because mindfulness cultivates these very parts of the brain that Dr. Shore alludes to here. Moving on to the next slide, I present several working definitions of mindfulness. Remembering to pay attention to what is occurring in one's immediate experience with care and discernment. Mindfulness can also be thought of as the master key for knowing our own minds, and thus as a tool for shaping and reshaping our mind. Mindfulness is paying attention in a particular way in this moment, non-judgmentally. This is the definition that's most often used and is presented by Jon Kabat-Zinn, who I'll discuss more later in the talk. One confusing aspect of mindfulness is the fact that it is both a process and an outcome. In other words, the process of mindful meditation and the outcome of mindful awareness. So keep this in mind, and we will discuss this further as we proceed with the talk. Here's a list of several of the qualities that are cultivated by a mindfulness practice. we might think of the mind as being very similar to a scientific instrument. And as with any instrument, it must be calibrated and stabilized on the platform which it sits for it to be accurate. Imagine for a moment looking through a telescope at an object in space, say the moon. Would we want the foundation upon which that telescope sits to be a stable and firm one? Or would we have that telescope sitting on a moving object, such as a waterbed or a boat or something like that? Obviously, we would want a firm, stable platform for our telescope so we could see images more clearly. By stabilizing our mind on a platform of mindful awareness, we are thus able to see things more clearly. So, stability of mind, discernment, clear seeing, the ability to see reality as it is. Wisdom grows from a mindfulness practice. Flexibility of thought, the ability to let go of our preconceived notions and ways of looking at the world and responding to the world can be changed, and we can become more flexible and adaptable. We can become more empathetic and compassionate, both in our professional lives, in our work with patients, but also towards ourselves. We develop and foster patience and the ability to just allow life to unfold without forcing things and letting things occur in their own due time. And finally, mindfulness offers us a path to freedom from our past, freedom from our conditioned responses that were learned in our childhoods, and the ability to let go and live our lives in each moment without falling into traps of automatic behavior or automatic pilot. On the next slide, we see the 7 attitudinal foundations of a mindfulness practice. The first is non-judgment. Non-judgment speaks to our habit of spending so much time thinking about what we like, what we don't like, what we want, and what we don't want. And these thoughts are just judgments. They fragment our world into an inner and an outer, and thus we create in our mind artificial separations based on our judgmental thinking left brain. This has a profound habit on our habits of thought, emotion, and in the way we sense that we know the world. These prejudices of our mind are the habits that keep us stuck and keep us from realizing our true potential in life. Patience is nurtured by the stepping out of time as we meditate. Actually, as we engage a mindfulness practice, we come to focus on right now, on this moment. And that's outside of clock time. As we develop our mindfulness practice, patience is thus nurtured, and we're able to learn that things unfold in their due time. Beginner's mind. In the expert's mind, There are very few possibilities. But in the mind of a beginner, there are infinite possibilities. In my own clinical work, I'm constantly reminding myself to come back to this foundation of beginner's mind, not allowing myself to jump to diagnostic conclusions too quickly, to be present with my client, and to not make assumptions, judgments, or label them. This type of approach with a patient will lead to them feeling felt. And this is the term coined by Dan Siegel in his work, and especially his recent book, The Mindful Therapist. Trust. Cultivating a trust in your own inner wisdom is an essential part of mindfulness practice. Learning to honor your feelings and intuition when something just does not feel right is a fundamental aspect of cultivating inner wisdom. When practicing mindfulness, you are taking responsibility for yourself and learning to listen and trust your own being. Jon Kabat-Zinn, with his Mindfulness-Based Stress Reduction program, which I'll be discussing later, refers to what he calls participatory medicine, allowing the patient to tap into and facilitating them to tap into their own deep inner resources and their own authority and power to influence their situation, no matter what it is. Non-striving. This is a very difficult concept for people from Western cultures, and especially from the United States. Striving is the American way. There's purpose in almost everything we do. We're either striving to get something or somewhere. In mindfulness meditation, this attitude is actually an obstacle. Mindfulness meditation involves focusing our energy into non-doing, not doing, and being, and not striving. There is really no other goal other than for you to just be yourself where you are, right now, in this moment. This paradoxical thinking may sound crazy, especially because most people embark on the mindfulness journey with a specific goal in mind, such as reducing pain, physical pain, emotional pain, reducing stress, improving their depression, lessening their anxiety. However, if you're to actually sit down and say, now I'm going to reduce my stress and my pain by doing this meditation, you've really introduced the idea into your mind of where you should be as opposed to just being where you are. And in mindfulness, we don't strive to be any place other than where we are in this moment. We so often get caught up in the relentless pursuit of goals as if achieving these goals was going to change much. So much of our energy and focus is on the future. Getting a raise, finishing a degree, finding a partner, leaving a partner. The possibilities are endless, and we somehow feel that we'll be made whole if only we could achieve those goals. In mindfulness, again, and this cannot be overemphasized, we focus on things being perfect as they are. And this can even be in the face of medical problems, chronic pain, because in the end, if you're still breathing, there's more right with you than there is wrong with you. Acceptance. Acceptance sounds pretty simple. It means just seeing things as they truly are in the present moment. But oftentimes we deny or resist what is, especially if we don't like it. Acceptance is only the most difficult thing in the world to come to, with difficult emotional issues in our lives. It's seeing things clearly as they are and accepting them without judgment. Again, this becomes that stable platform for your mind to see more clearly and thus act in a more wise manner. Finally, non-attachment, or letting go. This is a way of letting things just be as they are. Consider what outcomes in life you're attached to. Think about that and see if you can practice non-attachment with those. Surrender, letting go, letting be. There are many terms for this. This is the foundation of the 12-step movement, and very difficult. It's very difficult to let go of things that are difficult for us, even if those very behaviors or thoughts are causing suffering. Non-attachment is just letting an experience be what it is, moment by moment, without judgment. Now, here are a few things that mindfulness is not. Mindfulness is not religious in any way, or Buddhist for that matter, though mindfulness meditation in its most clear and definitive articulations throughout history have come from the Buddhist contemplative literature. But mindfulness in and of itself is universal. It's not a religious or Buddhist, and we don't need to practice Buddhism or know anything about Buddhism to engage in mindfulness practice. Mindfulness is not something that you learn intellectually in a talk such as this, for that matter. It's not so much taught by an expert in the typical top-down manner that we're so familiar with throughout our educational careers. So much emphasis was placed on developing our left brain cognitive processes of critical thinking throughout our educational lives, but hardly any, at least in my own experience, training in cultivating mindful presence and mindful awareness and thus wisdom was offered to me. So mindfulness is not so much taught by an expert or a learned exercise. It is a way of being. It's not so much taught as it is shared by the meditation teacher. Mindfulness is not about shutting down your thinking mind. Creative thought is very important, and linear thought is very important as well. shutting down our mind, not planning, these are not what mindfulness is about. If you try to shut down your thinking mind, you're going to get quite a headache. One way of thinking about that is this metaphor with the ocean. The mind is much like the ocean. You cannot stop the waves, but you can learn how to surf by learning to mindfully be aware of your cognitive processes and not self-identify with them. In other words, when sadness is present, not I am sadness, but I am aware of my sadness. Mindfulness is not a technique to learn how to relax or to be happy. Again, this is somewhat paradoxical because oftentimes these are outcomes of the mindfulness practice. However, one of our foundational attitudes of mindfulness is non-striving. So should we set the intention with our mindfulness practice that we want to learn how to relax? That's just another thought. Of course, relaxation, increased happiness, decreased physical and emotional pain, these are all outcomes of mindfulness. However, we have to keep in mind that the focus of our mindfulness practice is the moment-to-moment cultivation of awareness. And finally, mindfulness is not about trying to improve yourself or get anywhere else, but just to simply realize where you already are. I'd like to discuss some specifics about formal mindfulness meditation. Broadly speaking, meditation can be divided into formal and informal practice. The formal practice is what we normally think of meditation. Examples of that would be sitting meditation, yoga, a body scan, or a walking meditation. It should be pointed out that, especially to beginners of a mindfulness practice, that the meditation objects such as breath, sounds, sights, emotional states, or our cognitive processes are not the most important thing. Rather, the awarenessing of those objects is the goal and what we're cultivating. In other words, we don't so much focus on the breath as we do our non-conceptual awareness of breathing, just breathing. This is also reflected in the language we use in teaching mindfulness. We avoid directive language such as take a breath, A, because this implies a hierarchy of teacher and student, but it also creates that fragmentation of the meditating person and the meditating object, the subject and the object. Rather, we focus on the process of awareness or breathing, which leads to an integration of the subject and object. We don't just watch our breath. We are breathing. Jon Kabat-Zinn describes this phenomena as an orthogonal rotation of consciousness, this transition from subject to object. the letting go of self-identification of the story our thinking mind creates, oftentimes based in trauma of the past. This shift, this orthogonal rotation, allows us to disidentify with those thoughts, and thus freedom to be liberated from our past and be fully in our lives in this present moment. And we discussed several forms of our formal mindfulness practice, but we can also discuss informal mindfulness practice. This is the mindfulness we take into our everyday lives. Anything we do can be done with mindful awareness. Washing the dishes, making our beds, cleaning our homes, exercising can be done mindfully. Exercising can also be done non-mindfully, mindlessly, if you will. An example of people that might exercise in this way are people that check out when they run, and they run very intensely. And this can be just a distraction, like any other distraction, from seeing and feeling what's actually happening in the body in those moments while one is exercising. One exercise that's taught in mindfulness-based stress reduction is S.T.O.P, which is an acronym for stop, slow down, take a breath, breathe, observe what's happening, observe your thoughts, observe your emotional state, observe the temperature of the room, observe any physical sensations you might be experiencing, stiffness in your neck and shoulders, relaxation. Observe the felt sense of your own body. And then proceed. This is but one of many informal mindfulness interventions that we can practice throughout our day. I think you'll find them very valuable to both your own work you do clinically, but as well your own self-care and as a exercise that can facilitate self-care and calmness and effectiveness. But the point again is to just stop and check in with yourself and see what is there to be seen. So now we move on to a bit of an experiential slide. This is an exercise that I'd like you to complete. If you're feeling ambitious, if you have pencil and paper, jot down these 9 dots. And the directions are simple. Connect the dots with 4 straight lines without removing the pencil from the paper. As you do this, I invite you to notice and be aware of your approach to this exercise. Sometimes this exercise is described as a metaphor because it brings out in us conditioned responses. Perhaps it brings on anxiety or a compulsiveness to figure it out. Perhaps it brings on frustration because most people that approach this puzzle aren't able to solve it. Take a moment and try. Noticing your thoughts, noticing any emotions that come up as you proceed. Many times people get frustrated with this exercise and have difficulty solving it, not because they don't have the answer. It's because they're approaching the puzzle in the wrong way. In approaching this puzzle with your left-brained, problem-solving, linear thinking mind, you might notice familiar emotions that arise. I invite you, if you've not yet figured out the puzzle, to take a breath. Stop. Take a breath. Observe your own psychological state, your thoughts, your emotions, and then proceed. And the invitation further is to let go of trying to figure out this puzzle. Try to just see the answer. And I'm going to now move to the next slide, which gives the solution. So many of you might have been able to solve the puzzle and many not. It's irrelevant, actually, because the point is the noticing of what happens during the exercise. Many notice that the attempts to solve the puzzle resulted in trying to draw a box around the edges, and then frustration that the middle dot couldn't be connected. Thus, this exercise can be a metaphor for our own box that we place ourselves in. You might think of this as the conditioned responses and observations about ourselves from our own pasts. People have a hard time letting go of their fears, and out of a fear of the unknown, they prefer suffering that's familiar. So it was never stated that we could not go outside the lines in this exercise, and that then becomes a metaphor for our own suffering and our clients' own suffering. They tend to, and we tend to, stay with what we know, despite the fact that it continues our suffering. We want to stop smoking, but we can't stop smoking. We want to go to treatment or go to therapy, but our fear keeps us in our habitualized thinking patterns that were projected onto us from our past. Each moment that we live presents us a fresh opportunity to live an examined life. And we can create new choices that liberate us from those conditioned responses that we learned from our past. No matter how traumatic our past has been. The image on the slide shows a very familiar metaphor when talking about letting go of our conditioned responses, that of the cowpath. There's an excellent poem written by Sam Walter Foss called The Calf Path, which refers to a single calf that wandered through a field, creating a trail that was the next day followed by a dog. And over the course of hundreds of years, this path became the thoroughfare for a continent. And this alludes to our tendency to stay in patterns of automatic behavior, conditioned responses that we've learned from our past. We see this in our own lives, and we see this in the lives of the clients that we work with. Mindfulness gives us choices each moment to be aware that our past might be affecting our present. And it creates that moment, that instant moment of space between stimulus and response where a choice can occur. That choice is our own liberation from our past. This is the transforming element of mindfulness meditation, the ability to enhance our moments and to notice and be aware of our own automatized behaviors, and thus reclaim our lives and untap our own vast potential. The poet Walt Whitman said, "I am large. I contain multitudes." And he was right. However, as long as we're entrapped by our own conditioned learning and behaviors from our past, we cannot tap into our own potential for growth and wisdom. I'd like to talk about mindfulness-based stress reduction now. This is the program developed by Dr. Jon Kabat-Zinn. Dr. Jon Kabat-Zinn's academic background is from MIT, where he received a PhD and studied in the laboratory of a Nobel-winning scientist. He developed the now famous stress reduction clinic at the University of Massachusetts Medical School, a place where I've been to several trainings with him and his staff. Now, in 1979, mindfulness meditation was not such an accepted entity as it is today. Today, there's an explosion in interest in research in mindfulness-based approaches. And most of that is due to the work of Dr. Kabat-Zinn. But in 1979, this was obscure work. The stress reduction clinic was actually in the basement of the medical school. It was where the patients that had run their course through the normal medical system and not found relief were referred, and he took them all. Dr. Kabat-Zinn developed a very highly structured curriculum. MBSR is an 8-week program meeting weekly for 2.5 hours per night. It's quite a time commitment. In addition to the weekly meeting, there's daily homework. As well, there is a full day silent retreat on one weekend day during those 8 weeks. So in all, 30 or so hours of direct mindfulness training in an MBSR class. In addition, there's to the daily homework. MBSR is very highly penetrated across the world into medical, academic, and business institutions. The United States military is actually embracing mindfulness training for its soldiers. And there's a family of mindfulness-based interventions that have grown out of MBSR. MBSR incorporates several formal practices: sitting meditation, body scan, walking meditation, and mindful hatha yoga. These practices are introduced over the 8-week program, and there is intention given to the fact that several options are presented. Participants tend to gravitate toward one formal practice or another, but all are introduced. I'm not going to speak too much on the research support of mindfulness-based stress reduction. That speaks for itself, and there's been recent exponential growth and interest in this neuroscience. There was a meta-analysis done in 2003 that found usefulness of MBSR as an intervention for a broad range of chronic disorders. It found that MBSR enhances general features of coping with distress and disability in everyday life, as well as under more extraordinary conditions of serious disorders or stress. Improvements were seen across many standardized mental health measures, including psychological dimensions of quality of life scales, depression, anxiety, and other dimensions of disability. Physical parameters of well-being, such as medical symptoms, sensory pain, physical impairment, and functional quality of life, are also benefited by mindfulness-based stress reduction programs. The following is a list of other mindfulness-based programs, either growing out of mindfulness or directly from MBSR. Marcia Linehan's work in dialectical behavioral therapy and working with patients with symptoms and traits of borderline personality. Stephen Hayes with acceptance and commitment therapy. Mindfulness-based cognitive therapy for depression. Mindfulness-based relapse prevention as developed by Alan Marlatt. I've received training in this, and it is a quite elegant adaptation of Dr. Kabat-Zinn's mindfulness into working with the stress cues and cravings associated with addiction. They're also developing mindfulness-based psychotherapies as well as mindfulness-informed psychotherapies. Dr. Alan Shore, Dr. Dan Siegel's work are excellent resources to deepening your knowledge of how to approach a psychotherapy practice mindfully, or to even provide mindfulness-based psychotherapy. As I mentioned, business is embracing the concept of mindfulness meditation with the realization that productivity can be increased, but also well-being and contentment with work and is very much enhanced. The SIY, or Search Inside Yourself program at Google, is pioneering this, and there are many videos on YouTube of mindfulness seminars and lectures by very notable teachers such as Dr. Kabat-Zinn, Bob Stahl. They're available to the public as offered by Google. Something I found very interesting was the United States military adoption of mindfulness, MMFT, or Mindfulness-Based Mind Fitness Training. This is also a course that's taught over 8 weeks and specifically designed for individuals operating in extreme stress environments. MMFT provides skills training in 2 key areas: mindfulness skills and stress resilience skills. It cultivates mindfulness with specific exercises to build attentional control and concentration. It also helps soldiers by providing resilience skills training for coping with the physiological and psychological effects of extreme and prolonged stress. There have also been huge efforts to develop mindfulness curricula in education, and this is slowly becoming adapted. As I mentioned previously, all of my educational background and that of most, I would imagine, is really focused on cultivating our linear thinking left brain and not our moment-to-moment awareness and our non-conceptual knowing of things. But this is changing. So I'd like to provide some resources for the professionals that are listening to this webinar. You might wonder what would be the best start for a mindfulness practice. I would suggest an MBSR course. These are taught in communities throughout the world, in hospitals, and in other settings. As mentioned, it's an 8-week course, and it provides a very highly effective and empirically supported approach to developing a mindfulness practice. It's very difficult to develop such a practice on one's own. Typically, an interaction with a client and a therapist who has recently started a mindfulness practice might be to encourage a client to meditate or do yoga. And invariably what happens with that is that motivated clients will give it a try. However, without a structured and supported approach, they fall quickly into the trap of the thinking mind telling them and judging the experience as a negative one. Thoughts of, oh, I just can't do this, or mindfulness is not for me. I can see how it's beneficial, but I'm just too anxious. I'm just too sad. I'm just too this or that. Again, identifying with thoughts, which is the very point of mindfulness, to cultivate awareness of those thoughts and thus keep us out of our conditioned behaviors. So without the structure and support of a teacher that can not so much impart the knowledge didactically, but rather embodies that practice, embodies mindfulness, embodies present moment awareness and being with what is. By taking an MBSR course with such a teacher, one can complete the program and feel confident that the basics for sustaining a practice are there. Another resource would be a mindfulness retreat. These are offered at centers across the world. Many academic centers are becoming quite interested in this work, both from a research side but also from a experiencing and teaching side. For example, the University of California at San Diego Center for Mindfulness has an expansive and rich offering of MBSR classes, but also retreats. And such offerings are being put forth by academic institutions across the United States. Information for several research articles will be provided for participants who would like those resources. Dr. Jon Kabat-Zinn's book, Full Catastrophe Living, was published in 1990 and is a very clear articulation of his thoughts about mindfulness, the effects of stress on the human body, and how mindfulness can help us move beyond those stress and let go of the past and live more presently in the moment. His book, Coming to Our Senses, is also recommended. Dan Siegel's book, The Mindful Therapist, A Clinician's Guide to Mindsight and Neural Integration, is a good starting point for psychotherapists and psychologists and physicians with interest in bringing mindfulness-informed therapy to their clients and patients. Shauna Shapiro and Carlson's work, The Art and Science of Mindfulness, Integrating Mindfulness into Psychology and the Helping Professions, published by the APA Press in 2009, is also an excellent resource and provides much information about the empirical support for mindfulness practices. So in summary, mindfulness is paying attention to this moment non-judgmentally and as if your life depends on it, because it does. Our life is nothing if not a series of moments. We get to choose how many of those moments we are present for and just how present we are. We don't know how much time we have until we die, but there are an infinite amount of moments until then. So slow that process down, if you will, by becoming keenly curious about each moment. And I refer again to the 7 foundational attitudes of mindfulness meditation. These are the bedrock attitudinal ideas to consider and embody in your mindfulness practice. And finally, I mentioned resources for developing your own mindfulness practice, and those are legion. Mindfulness is literally spreading throughout the world, and there would be very few places where mindfulness offerings would not be offered. But the best way to start a mindfulness practice is simply to decide that you're going to start a mindfulness practice. I don't mean to be trite, but sometimes our own hesitation to start a mindfulness practice, the reasons we choose not to do that, might be more related to just our lack of coming to that decision to just begin, and the rest then will fall into place.
Thank you, Dr. Best. We appreciate your time. So many questions have come to my mind, but we are actually out of time today. So I wanted to thank you first for taking your time. And then for our listeners, on the screen in front of you, we have the steps to take in order to get your continuing education certificate. Immediately following the webinar, you will receive an email with an evaluation and post-test attached. We ask that you complete both forms and return to the email address on the screen, TRI, which stands for the Rosewood Institute, at rosewoodranch.com. Upon successful completion, a score of 80% or better, and receipt of the post-test and evaluation, a CE certificate will be mailed to you. If you do have questions, please send those to tri@rosewoodranch.com, and we'll make sure to forward those to Dr. Best and to get the responses back in a timely manner. Again, thank you so much. And I have one quick question before I close out. Does Optimal You offer mindfulness retreats?
We don't offer retreats yet, but I do offer the MBSR course.
Okay, great.
So thank you for asking.
Thank you so much. And if you want more information on the course that Dr. Best offers, please email us that question as well. Thank you and have a good day.